Good evening, everybody. A very important show tonight. We have two doctors right now live to answer your questions and sharing how Roe versus Wade ruling will impact local health care and New York women. So we want to talk to you. If you have any questions, again, we have two doctors right now answering your questions live. Again, this is a historic week. I can't believe it's only been a week. It feels longer than that. In the wake of the SCOTUS ruling overturning Roe versus Wade, women are seeking reproductive health care. They may face new legal and medical obstacles, so we're here for you. We want to answer your questions. Two doctors, phenomenal doctors standing by. One of them you know very well because she's been on our show many times. So many of you worry, though, that the ruling could have a negative impact on women's access to health care, rightfully so. In New York, lawmakers have been preparing for that influx of out-of-state patients. Now, what has the response been here locally, here in New York and New Jersey, since last week's decision? Let's hear from my colleague, Kala Rama, with more.
In the subways, airports, and bus terminals, these signs will let you know your right to an abortion, and it's the law in the state of New York. Last month, Governor Kathy Hochul pledged a $35 million investment to abortion providers across the state to expand capacity and access in anticipation of the Supreme Court ruling, taking away a woman's fundamental right to an abortion after nearly 50 years.
The court somehow believes that guns have more rights than women.
Are you at all worried about the influx of patients that could come here to New York to get help because their states would not be offering?
New York is always going to be a safe haven for women. We are working on different fronts, the council, our state partners, making sure that we have proper funding. For anybody wanting to come into New York State, New York City, you've got a place to come if you need health care.
The New York Civil Liberties Union wants to make sure those who come here from out of state for reproductive health care have their privacy protected and believe the Reproductive Health Act, passed in 2019, allowing abortion should be cemented in the state constitution.
That means that the governor has to call.
That was Speaker Adrienne Adams, a friend to our show, and she said that New York will always be a safe haven for women. Dr. Iman is joining us now. She's the CEO and co-founder of Incredible Health, also Nurse Career Marketplace. We also have Dr. Gaither, if you recognize her. I don't know how many shows you've been on with us, but she's such a resource for us, always available, especially to our women who are watching. Such a rich resource of information. I always listen. Everything you say, I take it home with me. Thank you both for joining us. But could you just tell us a little bit about yourselves first? Dr. Iman, you first.
Sure. My name is Dr. Iman Abuzaid. I am the co-founder and CEO of Incredible Health, which is a career marketplace for healthcare workers. I'm an MD by background, been in technology for many years of my career. And we are the fastest growing career marketplace for healthcare workers. Hospitals use us to hire nurses in permanent roles in 20 days or less.
We're going to talk about this nurse crisis that we're having, a shortage right now. Dr. Gaither, tell us about yourself.
I am a maternal fetal medicine specialist, and I am the director of perinatal services at a hospital in New York.
I'd like to encourage everyone watching, if they want to drop a question right now, we're going to ask these doctors live for you. Ask anything you want. We're going to put it. We have two producers standing by watching questions. Now, Dr. Iman, let's get right to it. The ruling has not only created this heated debate for many women, but for healthcare providers as well. What are some of the challenges that we're seeing now?
Yeah, so we have data from across our marketplace. We have over 400,000 nurses on our marketplace, including many, a huge amount in New York as well. And, nurses have really gone through a very tough time in the last couple of years, as well as doctors, of course. And, right now, about 34% of nurses are considering leaving the profession permanently due to burnout and workplace stress. So a ruling like this does change things for healthcare workers. It really it increases the number of patients that they need to work with, and I'm sure Dr. Keisha will be able to comment on the impact on patients and how that changes patient volumes. But this is during a time where the healthcare workforce is already quite burnt out, and they are being overworked, and there's unprecedented turnover in this industry as well, as nurses leave the profession permanently.
I mean, this is terrible news. There are frontline heroes that, went through the pandemic with us and saved so many of our own family members. 1 in 3, I just have to repeat that one more time. 1 in 3 nurses are already planning to leave the industry. And now this, what do you foresee will happen now?
I think we will see increased levels of turnover, unfortunately. I mean, we know that nurse executives, hospital executives are really trying to battle the increasing turnover and burnout that's happening. And they're trying to hire as rapidly as they can as well. But when you have a situation like this, where it really does affect almost every type of nurse and doctor, regardless of specialty, because this does affect all women who are of pregnancy age, it will be increasing the burden on the healthcare workforce.
And specifically in the Black and brown communities, can you talk about, we've covered so many stories, already resources are low. What will this mean?
That's right. So with abortion bans, maternal death increases by 21%. And within certain communities, like the Black community, it actually increases by 33%. And so, yes, there will be more mothers that die as a result of this, and healthcare workers who will be put in very difficult positions deciding what to do, because they will now, in certain states, have limitations on what they can counsel and what they can recommend to their patients, and also have legal risk.
I'm glad you're saying that, because what do you tell nurses still on the job? It sounds so dire. What do you tell them?
Look, at the end of the day, there's actually there will be healthcare workers on both sides of this debate, just like there was for vaccines. Vaccine mandates were also very controversial, and they were not accepted by all healthcare workers. And encourage nurses and other healthcare workers to seek support at their workplace, and with their HR teams and managers, and just try to be compassionate towards one another, because it still is a controversial topic, even among the healthcare workers.
A lot of women commenting, and if you have a question, please comment right now. We're live with 2 doctors. Now, Dr. Gaither, you've been on our show so many times. You're an OBGYN, and it's amazing. Some doctors I don't understand I understand everything you say, and that's why I love having you on our show. So many complicated issues to understand. But in a real simple way, when you heard the news, I guess preparing for that potential increase in the amount of out-of-state patients, what does that mean for access right here in New York?
The access will always be there. I will say that. However, there's going to be a marked influx. And with staff that are already burned out and with a high attrition rate, I think it might be problematic for a bit.
Yeah,
I definitely think that.
We've been hearing the resources are coming, that our city and state officials they did spring into action, and hopefully
Yes.
are, putting more funding.
Yes.
But let's talk again about Black and brown women. That nationwide, we've done the stories, mortality rate, that's 2 to 3 times higher than white women. Do you think that this ruling will create even more of a divide in the healthcare of women of color?
Absolutely. Absolutely. I think it's going to magnify disparities. I think it's going to increase morbidity and mortality. We're going to have more women coming in with complications of procedures that have been deemed unsafe, with sepsis, infection, ending up with hysterectomies, and in order to save their lives. I think that there's going to be a marked increase in morbidity and mortality among people in Black and brown communities. That's coming.
Live on Facebook, I want to make sure that, for both of you, I want to give you the chance to answer this question. What do you want women to know watching this show? 30 seconds. Let them know right now. Is it a message of hope? Is it a message? What do you want them to get from this show? Dr. Iman, can you go first?
Sure. Without going on either side of the argument here, like at the end of the day, there is support and there is access out there, but you have to try to seek it. So, for example, the Planned Parenthood of Greater New York is already planning for a 20% increase in appointments, as women travel to states like New York to get the reproductive care that they need. So it's still, there's still support out there, but definitely if you are in a more marginalized community, or if you simply cannot afford to travel, this is a very problematic situation.
Sure.
I'm aware that not only is there support from, our legislature, but also there are certain organizations which have already started getting funds ready to assist women with travel, with hotel stays, with the ability to pay for procedures. So just to piggyback on Dr. Abuzid, there is support out there.
One final question that I forgot to ask was this overturn of Roe versus Wade. What impact does it have? This is an important topic, field of reproductive medicine, specifically when it comes to contraceptives. We forgot to talk a little bit about that. I'm glad I remembered that. Dr. Gaither, you first.
I think there's going to be a marked increase in women getting long-acting reproductive contraception like IUDs. So I anticipate there's going to be a marked increase in women coming for appointments for that type of contraceptive device.
Dr. Mon?
Yeah, similar comment as Dr. Gaither. We will see an increase for that. And then the other thing is, like, it's also going to change how healthcare workers are trained and how they operate. That if there is a complete change or increase in miscarriages, in still dealing with stillborn, dealing with life-threatening pregnancies, dealing with ectopic pregnancies, then the training and support that the healthcare workers need to provide to their patients is going to change.
And to get more nurses trained and ready to be on the front lines because of this burnout, or are we just reacting now, or is there a way to expedite that process?
Yeah, so nursing schools are getting record numbers of applications, so are medical schools. But despite that, it's still not enough to meet the demand of the country's demand on the healthcare workforce. Nursing schools and medical schools don't have enough capacity to train that much more. And then the other thing is there's another bottleneck after school in terms of getting them specialized as well. So, Dr. Gaither is highly specialized, but for a medical doctor or even a nurse to train in labor delivery or OBGYN is increasingly becoming more difficult because there are far fewer healthcare workers that are experienced in order to train.
Incredible information. Thank you both. We got 2 doctors tonight. That is a record for us here on our Facebook show. I'm so grateful for your time. I know your time is so valuable right now, but so many women, so many men too, commenting tonight, and such an important show. So if you know anyone who needs information, please share the show. And thank you so much, doctors, for your time. I hope you'll come back. You can always count on us right here on Facebook to talk about the news of the day, but also the issues that you're facing, and help you along a little bit. And don't forget, we're also on every night at 5:55, 4 o'clock, 5, 6, and 10. And we continue to fight for social justice, not just in food insecurity, housing, healthcare, education. Reach out to us and we're here for you. And thank you for watching this evening. Good night.